To those who are joining right now, welcome. We will begin in a few minutes. We're waiting for people to drop in. All right, we'll give it one more minute and then we can start. All right, let's get started. So welcome everybody. My name is Lotta Vellen and I'm the Global Health Secretary of the Swedish Society of Medicine's Junior Doctor section. And I'm very happy to welcome you to the final event of this year's Global Health Week. And this year, the overarching theme has been Global Public Health. And this is the 5th event of this year's series. And we have tried to focus on this topic through different perspectives. We've been speaking about gender and health, climate change and health, and in particular, how it affects children's health. We've been talking about social determinants of health. And then we also had an event on trade and health, how international trade agreements affect health. And so to round off, we're going to kind of take a step back and look a bit more holistically at global health. What is global health? Why is it important? And how can we tackle global health in a good way? And this is something I personally think is very interesting. And I'm so excited to welcome 5 great panelists today. So first up, we have Hampus Holmer, who is a postdoctoral researcher at Karolinska Institutet in Stockholm. He's also currently a desk officer at the Global Health Department at the Swedish Ministry for Foreign Affairs. Next, we have Sahar Najat, who is a pediatrician, public health and immunization advisor, and a guest lecturer in global and humanitarian health at Karolinska Institutet in Stockholm. And we also have Mahmoud Homsi, who is a student representative from the Decolonizing Global Health student group at KI in Stockholm. We also have Sibylle Hertig van Bees, who is a senior lecturer and associate professor at the Department of Women's and Children's Health in Uppsala. And finally, we have Jesper Sundevall, who is an assistant researcher at the Division of Global Health and Social Medicine at Lund University. And so the structure of today's event will be that these 5 panelists will have 3 minutes each to present their kind of perspective on global health, the what, the why, and the how. And then we're going to spend the majority of the session in a more interactive Q&A session. So if you have any questions to any of our panelists, please feel invited to send them through the Q&A box, or if you prefer, you can write in the chat. We are also sending live on Facebook, so if you're watching through Facebook, you can also comment below the stream, and then I will try to also keep an eye open there. So let's get started. I will hand over to Jesper, who will be our first speaker.
Thank you, and welcome everybody who's listening, and thank you for the invitation to be part of this panel. What is global health was the question I tried to take on, and I took it was so advanced, I took a picture of an Earth and a coronavirus, and then I made one of 50% transparent and put that as my slide. But it indicates that I will talk a bit about what is global health in the context of the COVID-19 pandemic. As has been argued by some, global health is public health somewhere else, which is quite a witty way of putting it, implying that what is global is simply what is not local, right? But a few months ago, 2 of the panelists of today, Hampus and Sibyl, they argued that we need to move away from this notion because it's difficult to determine, when a health issue transcends a border. And therefore, global health needs to be understood in a much more holistic sense rather than in a geographical sense. And to me, that makes a lot of sense, and I'll try to tell you why. Well, if we understand global health in a holistic sense, the current COVID-19 pandemic, to use it as an example, would rather have us ask the rhetorical question, what is not global health? And there are many ways we can illustrate this, but let me give you 3 examples. I think first, most people would agree that global challenges require global solutions. And we define a pandemic as an epidemic occurring worldwide over a very wide area, crossing international boundaries and usually affecting a large number of people. But still, the response to COVID-19 has been largely nationalistic and rather reinforced what I call an unglobal health approach. Secondly, and building on what I just said, this unglobal health response has global implications. As an economist, I've been trained in understanding the economic implications of global events. As an undergraduate student, I remember very clearly how we modeled a macroeconomic effect in Sweden of an interest rate increase in Bolivia. And of course, the economic effect in Sweden of an interest rate increase in Bolivia is marginal, but it did teach me that in a globalized world, we are one economic ecosystem. And I think that more and more, we're also one health ecosystem. And third, what I want to say is that what relates to the ecosystem perspective is that the pandemic has shown and will continue to show the indirect health consequences. The unglobal response has focused on morbidity and mortality in countries, and comparisons have been numbers that have contributed largely to simplified pictures of failures and success. But the indirect and long-term health consequences of, for example, a poorly justified 6-month school closure in Zambia is much more abstract. Or the implication of disrupted global logistics change, leading to vaccination campaigns being cancelled, or lack of access to family planning commodities. We know that all these measures will have, or all these indirect consequences will have health implications. And we know that, like in most cases, it will hit the most vulnerable the hardest. But we don't know the scope or long-term health consequences yet. So coming back to the question, and I'll round off, is that what is global health then? Well, as I said, I support, an holistic perspective as an intellectual way of understanding it. But my idealistic perception and interpretation, and I do hope that idealism is not completely dead yet, would rather be that it means that the health of each individual in the world would be just as important as my own health. Thank you.
Thank you very much, Jesper. I will now hand over to Sibyl.
Thank you very much. And I have a few thoughts to share on the three topics, the what, the why, and the how. To begin with, in terms of the what, there is a lot of debate about the meaning of global health, what it is, for instance, whether it is a field or a sub-discipline, or what it should aim to do. And drawing on Copland's notion of global health as having at its center to improve health rather than health care and achieving health equity. These are certainly features that I believe are very core. But building on what Jesper was just saying, and as and I have argued, we often conceptualize and practice global health as public health somewhere else. And we should shift away from this notion of it being about geographical boundaries, and instead focus on the global scope of the discipline. And this is where I would really advocate for it being a interdisciplinary or transdisciplinary field. However, many misconceptions about the meaning of global health prevail. And too often we come across examples that make it clear that global health is really an extension of international health with a strong focus on vertical disease programming and achieving goals in the global south. In terms of the why we pursue global health, here I would highlight the fact that multiple interests are at stake. And this is something that is often forgotten. They may be based on altruism, on aid, political reasons, economic reasons, religious reasons. But the issue at play here is that often global health is conceptualized as something, an image of doing good, or embedded in this notion of the white savior, albeit efforts to discuss these challenges. I believe we're still not sufficiently interrogating some of these issues at both a personal level, but also at a institutional and practical level. In terms of how we practice global health, I think more reflection and effort, more reflection and effort has gone into how we do global health. There's been a lot of reflection around co-development, what it means to be in a true partnership. However, we also have increasing evidence, because we're asking these questions, about power imbalances at various levels. So at practical levels, that is in aid, for instance, but also in research and in education, which prevails and which we rarely interrogate and need to continue to interrogate. Thanks.
Thank you, Sibyl. I will now hand over to Mahmoud.
Hey guys, good evening. So I'm going to focus on why we need a decolonization movement in global health. Some of you might be asking, why do we need to decolonize global health? And what I'm going to do is to introduce some common examples of issues that are encountered very often in the everyday practice of global health, and use that as a quasi-evidence for the need for decolonization. I think Sibyl mentioned white saviorism, so I'm going to skip that one. And I'm going to talk about another example, which is called safari research. It's when we usually see a person flies into a low middle income countries, stay a short period of time, uses the locals, assess him in implementing his project, he collects his data, he leaves, he publishes, no co-authors, no collaboration with any local institutions. This is a very common thing that we see and we continue to see, even though it's frowned upon in the field of global health, but it's still a very common thing to see. Another issue that we see in global health that is a problem is the funding. If we look, first of all, we need to actually agree that global health now is an income generating and a very lucrative industry. If you look at us here at KI, our annual research income is around 5 billion kroners. That's more than what entire countries have, not for their research budget, for their whole health budget. So there's a big gap and difference and inequality in the resources. Another example that we see in global health that calls for decolonization is actually that setting the global health agenda and priorities is usually a process done in the global north by the global north, even though it affects the whole world. An example of this would be how antiretroviral drugs for HIV, although they were invented in the 1990s, it took them almost a decade to be available and within reach for people in the global south. Millions of people died while they were waiting for that to become a priority in the global health world. And finally, I'm going to touch on the issue of racism and diversity. In global health, most known researchers are from the north. Most editors are from journals are from the north. And most senior management positions in global health institutions are from the north. So that kind of poses a problem and lack of diversity in global health. And of course, the last example would be the full-blown racism that you see sometimes with unethical research being conducted in the global south that probably will not have passed the ethical review process of the north. I really hope that you guys have already noticed those issues before, but if not, I hope you start noticing them now. So I'm hoping that this open your eyes to some of the problems and how important it is to start the decolonization movement. Thanks, guys.
Thank you very much, Mahmoud. Next up will be Sahar.
Hello, everyone, and thanks for inviting me, and thanks for excellent speeches up till now. I will relate to them, of course. When I started with global and humanitarian work, I had quite high ideals. I wanted to work for justice, and I wanted to work for humanity. And I had fantastic years, and I met some of my very best friends in the field, and they are still my best friends. But today I don't want to talk about that narrative, but what I want to talk about is the other side of the story and the deeply rooted power imbalances that we see in global health. So global health is about social justice, equity, solidarity, right? Or is it really? According to the Global Health 50-50 report that you see here on the screen, global health still has power structures rooted in colonialism, imperialism, and patriarchy, end of quote. Many of the global health organizations, they lack diversity, equity, and inclusion themselves. So for example, 2/3 of executives in global health organizations are men, often from high-income countries. And 2/3 of their headquarters are situated in Europe and North America. This is still from this report. And just as an example or experiment, just Google humanitarian organizations or global health organizations that have offices in Sweden. And just ask yourself, are they even reflecting the diversity of Swedish society? And I can reveal that we are no better. And I also would like to talk about, and I know Sibyl has already talked about a little bit, and even Mahmoud, about how we use the expression of global health. So for example, if a doctor from a rich country goes to rural Uganda and works, then that's global health. But if a doctor in Uganda goes to the rural Ugandan setting and does exactly the same work, then that's not global health, or is it? Or just ponder if the same doctor would come to Sweden, the Ugandan doctor would come to Sweden and work in rural Sweden with vulnerable population. That's not, we usually don't call that global health. Is that global health? Just a question. So I just want to cite Seya Ambola, former chief editor of BMJ Global Health. He asks, does such work only become global health when it's done by a person or with funds from high-income countries? Now, for all of those of you who want to serve other people globally, which I really would like to encourage you to do, We need to be aware there's a power relation in a mindset that pities other people without seeing the cause of their misery within the wider political, economic, and social context. And this is why I argue that global health teaching needs to go beyond those colorful bubbles of statistics and also answer why some people are left behind and how we can address this in relation to the existing power structures. And I want to just finish with a quote that you see here. If you have come here, from activist Lily Watson, she says, if you have come here to help me, you are wasting your time. But if you have come here because your liberation is bound up with mine, then let us work together.
Thank you very much, Sahar. I will now hand over to our final panelist, which is Hampus Holme.
Thank you, Lotta, and thank you so much, my phenomenal colleagues, for these brilliant talks. I mean, there isn't much to add, I feel like, and I thought I'd maybe start with just reflecting on some of the things that Jesper, Sibyl, Homsi, and Sahar have all brought up, and I think there are some things that cut across. But first of all, just comparing this conversation with conversations we've been having in similar sort of constellations. I was part of the group that started these Global Health Weeks a number of years back, and the way that we even talk about global health has changed over time. So I think this is really positive, the way that we are now bringing up issues like equity and challenging notions of power, privilege, priorities, and as Homsi is pointing out, these very problematic practices which are still prevalent, that we are trying now to address more and more. So there's some positive things happening here, and there's still a room for idealism, as Jesper pointed out as well. With this slide, I want to also draw your attention to what should be our goal in terms of human development and in terms of global health. Because clearly, from what you've heard from all of these speakers, health is so closely linked to everything else in society. Health is not something that happens somehow in isolation, separated from everything else, but rather is inextricably linked to almost every other part of human society. And this is another economist. So we started out with talking about economy with Jesper, and now we're sort of ending on the economist's notion here as well of the donut economy. A new way of thinking of what we want to achieve as society. And there are two aspects to that. On the one hand, a floor, a minimum level of what society, as a collective society, the whole globe, should achieve for all of its peoples. Every individual's health is important, as Jesper said. So we need a social foundation whereby everyone has the right to the best possible level of health, which includes then nutrition, food, water, energy, networks, housing, gender equality, social equity, political voice, peace and justice, income and work, and education, as you can see in this slide. But on the other hand, we also must think about how we do that within the boundaries of our planet. And there is massive overshoot already today. We are seeing the planet, both the environment and the climate, being severely impacted by all of these various factors that you can see here, such as pollution, biodiversity loss, land conversion, and so on. So let's aim for a safe and just space for humanity, where health is an integral part, but where we are also, as practitioners within global health, considering the bigger picture. And I'll end there, and I really look forward to discussing with you around this.
Thank you so much, Hampus, and thank you everybody for your great presentations. So I think you all touched on very interesting perspectives, and I know the presentations were very short, but I believe that it has stirred up some more questions that we can now discuss together. And so to start off this Q&A session, I want to direct this one question to all of you. And whoever wants to jump at it first, please go ahead. What is global health to you? And is there a difference between global and local health? I know this is something that Sahar, you spoke a little bit about, but I would love to hear more of your thoughts on this.
Okay, I can start. I know also Sibyl mentioned Jeffrey Kaplan's definition, but this is not about how it's defined, but what it may be, this is more how we should use global health. And for me, global health is what it means. I mean, global, everything that is antimicrobial resistance, climate change, all of these health challenges that are have no boundaries. They need to be tackled globally, and they are global health. And also, as has been mentioned, equity is a large component of this. I think we need to be careful calling like clinical research in a certain topic in just because if it's in an African country, global health, because I don't think the global health expression will survive this way, because I think it should be focused on what is really global, because I think I'll stop there.
That is very interesting. Does anybody else want to respond to that?
Yeah, maybe I can just follow up in terms of the word global, and this is something Hampus and I have talked about. I think we've really sort of tried to move away from this idea of geography, but rather sort of think about disciplines and disciplinary scope. Often global health is seen as a sub-discipline or a subfield of public health or medical sort of sciences, or and often these centers and departments are actually embedded in medical faculties. However, there's this whole literature and this whole sort of the questions around it, but then also the literature and the other disciplines that deal with global health from a different perspective. And I think, as Jesper was saying, COVID-19 is an excellent example that highlights the need for interdisciplinary work on global health. It is not just a medical problem. Like, what we're seeing is very political. It's highly politicized, which means we need political scientists, IR people, we need policy people, anthropologists. So we have to move away from this idea that it is simply, that it is somehow embedded in the medical world, which not everyone agrees with.
Yeah, well, I think that's a really interesting point. And I think that also aligns a bit with what Sahar said, that if we label clinical research in a low-income setting global health, then that may also kind of push global health more in the direction of the medical field rather than towards this more interdisciplinary space. Hampus, did you also want to comment on this?
Yeah, and it looks like Jesper has also unmuted himself. So maybe Jesper, if you want to go first, go ahead.
I'm not sure I want to go first, but I can go first. I think what I want to say here really, but I think one thing is the discipline of global health, and of course that is a very confusing discipline, and we use it to sort of talk about people who are doing research in low and lower middle income countries related to health, I guess, and that's by definition problematic, and as a discipline we need to figure out how we get away from that. But secondly, the other thing, like, what is global health? And I think the COVID-19 pandemic has helped me understand this idea of, is there anything apart from personal health and global health? I'm not so sure, because everything is linked one way or the other. And I think these sort of indirect consequences on health has become so strikingly clear with how non-health measures affect health, has also become so strikingly clear with this pandemic. And also how that is, and I guess that's one of my hang-ups is that is subordinate to the, when people are dying and getting sick is so much more tangible in terms of problems to deal with than the fact that a young girl cannot go to school for 6 months and thereby run a high risk of falling pregnant and thereby running a higher risk of contracting an HIV infection and etc., etc., which probably has a lot worse long-term health risks, but they're intangible and far away and extremely abstract at this point. And we cannot sort of have those two thoughts in the head at the same time, it seems.
Mm. Mm. Then I'll just follow up right away and say, I mean, I obviously agree with what my colleagues here have said, and my way, I guess, of thinking of also about the definition of global health is related to the context in which we're talking about it. So if we're trying to define it for the sake of defining it, then sometimes I also wonder, whether we even really need a very strong definition. Whereas when we're talking about global health education, for example, and we actually have to define a curriculum, we have to decide what do students in medicine or nursing or public health actually learn about how to improve people's health. Then the concept of defining what is health and what is global health becomes really interesting. And there, I think there's been a problem, not least in the Swedish context, but I know also internationally I'd say around the world, really. There are some exceptions like Cuba or Laos and some other countries where the medical curriculum also actually includes political science, history, anthropology, and so on. But otherwise, we have this tendency of really looking at things from a very medicalized point of view, whereas the very simple attempts that have been made to try and define what proportion of people's health is actually can be derived from what doctors do in the hospital versus what the rest of society does, show that hospitals have very little to do with the overall health of the population. That, of course, changes depending on the level of development and whether we're talking about immunization and treatments that are life-saving versus places like Sweden, where a lot of health outcomes are actually also then defined by when everyone has the basic immunizations, the healthcare system has less of a role to play, perhaps, and that's where things like equality and so on comes in, and we come back to Rudolf Virchow and his statement that medicine is or politics is medicine on a larger scale, and medicine is really a social science in its essence. But that goes for education. When we're talking about research or even development or aid and so on, it becomes then also interesting to think about what is the most pragmatic. How can we best a collective sort of how can health best be improved? Their notions like those Homsey's brought up around the power imbalances and sort of structural racism and so on are actually very much hindering improvements because they sort of stand in the way of achieving more equitable health. So it'd be interesting to also hear your views.
Go ahead, Holmes.
Yeah. I find this very interesting that we're having a typical medicalization, demedicalization war between us. It's something that's been going on for so long in the field of global health and public health. And I think that there's this tendency for people with medical background to dominate the field and dominate the narrative. But I also think that the term itself was a misnomer. When we say demedicalization, people tend to get defensive. I think what we need is more diversity in our field. And diversity here doesn't mean a checklist where you just say, we have different people, we've done good. We need different people because different people have that different knowledge that enriches all our understanding of global issues. So to come back to what Hampus said about the structural racism, it's not just racism that is hindering people's ability to control themselves and control their future. Is hindering the whole field of global health of moving forward. And this needs to stop, and it starts here. And I just want to say that maybe we sound a bit of like very critical, but I think that I like to think of ourselves as the loyal opposition. We're kind of criticizing to make it better. And I do think that a lot of things have changed in the past 10 years. At least for me, when I was in med school, things were not like that when we talked about global health. So I think there's a lot of improvement, but there's a lot to be done still. Thanks.
Yeah, I really love that message. I think, as you said, it can get a bit dystopian sometimes when we speak of like a critical perspective of global health. And so it's nice to hear what you just said about is actually seeing that progress. And as we're talking about what global health is, I do want to take a step forward and think about the why. Why is it important to define global health? I think sometimes in global health, we tend to get a bit caught up in our own academic bubble, and we speak to one another about something that we think is very important in terms of an academic interest. But is it important to define global health in terms of implications for the field of global health? I'll open the floor to whoever is interested in answering this question.
Go first. Okay, you go. I think, as Hampus was saying, question around whether it needs to be defined or not, and there are opinions out there who say maybe we don't need to define it so very rigidly. Maybe keeping it quite open and flexible is a good thing. But there are instances where discussions about the definition have been useful, I think. And some of the recent papers that have asked questions about what is global health have raised precisely the issues that we've just talked about. So issues around problems with the focus on the geographical scope, problems with this sort of north-south divide, the problem of the north-south divide. So the definition, thinking about the definition and not just accepting Copland's sort of static definition is forcing us to engage with difficult questions that some of us have just sort of ignored because it was easier to do so. And we do need definitions for educational programs, and it is a good way to think about what educational programs want to achieve. And again, this can raise issues and discussions like having a curriculum that is far too medical. I've certainly been part of these discussions, and they are difficult, and sometimes they go nowhere, but at least they're happening. So that is a step in the right direction.
Thank you very much. Sahar, did you want to add on to that?
Yeah, but she always speaks so well, so I don't know what to say. But okay, what I wanted to say is that when I was a student in global health in my undergraduate, it was quite confusing for me. I mean, I was, wow, this is a really interesting topic. But then it took many years. It took before, like when I studied my master's, I realized, okay, policy is its own field. And you know, policy was really abstract for me during my whole undergraduate studies. Like, what is that? And I still, when I'm talking to my clinical colleagues, they don't understand that that's a separate topic, and that you can be an expert only on policy, and so, you know, it's and for me, when I studied my master's, I understood, okay, so it's like either you do epidemiology, or you do policy, or you do health systems, or you do clinical research, and so yeah, I think so. That's why I think it needs to be defined a bit better. And another reason is what we've already mentioned, that the current definition, the way it's used, and I'm not talking about how certain professors are defining it in the Lancet, etc., but how it's used is quite colonial still, and it only works one way, and that's for me problematic. We cannot continue doing that. It needs to be global health in Sweden, has to be global health in Rwanda, in Iraq, in Malaysia. It has to mean the same thing, and it cannot depend on where you come from or where you get your funding, because it is colonial somehow, and yeah, so it needs to change. Yeah.
I think that's a great comment. We have received a question in the Q&A that I wanted to bring up, and for everybody listening, please feel free to continue sending in questions. The question is, how can we encourage the inclusion of other fields outside of medicine in efforts related to global health or global public health? In what capacity is this most important? And perhaps I can direct this question to you, Jesper, as somebody who's not a clinician or somebody with a medical background in global health. And now I'm putting you on the spot, so if you want to pass it on, feel free.
Yeah, no, it's fine. And I'll pose the question back, which is the easiest way out. How can you not engage other? But I think, and I wanted to come back. I was thinking if I should comment on what Sahar said or not. But maybe one of the challenges is when you enter this from a medical perspective, is that your discipline, at least from an outsider perspective, is so focused on specialization. I mean, the whole track is you get more and more specialized. Now you're so super specialized. You can't even say you're a surgeon anymore. I mean, you're a specific surgeon on a very specific part, or, yeah. So it's becoming incomprehensible. And that's the only thing you do, and you're super good at it. At least that's my impression. And global health is really not about being a specialist, at least not from my perspective. It's about being a generalist and trying to raise your eyes. And exactly, I mean, you can't understand, I would say, you can't understand problems in global health unless you involve other disciplines. If you try to do it from a medical perspective, you're not going to get it. So it's not like, how can we? How you must, and it's already being done. I mean, there's so many people out there engaged in global health, myself one of them, who are not a medical person and do not have a medical background. So maybe it's a silo problem rather than those people not being there. They're there already for sure.
I'll just quickly add.
Definitely.
I would like to just challenge the question a little bit and say, for building a bit on what you're saying, Jesper, like non-medics are already there. We've been doing work on global health for decades that has been completely ignored. Like we see the Lancet has now embraced this idea that health is political. And I've been in conversation with some of my colleagues, anthropologists, people in development and development economics, who are saying, and political economy, who were sort of saying, well, we've kind of been saying this for decades, literally. There is literature out there, but the problem is that we're not exposing students and to that literature. And these are also things that I'm sort of really struggling with. It's very difficult to change these very medicalized curricula. So there is lots done already. So global health is not a medical discipline, it is a field, and lots of other disciplines have contributed to this field for decades.
Maybe I'll also jump in. I've been overly polite here and been raising my hand for a while, so
apologies.
I'll just take the word instead. And I think on that note that Sybil raises, it's even true actually within the medical field that there has been for 45 years a specialty in Sweden called social medicine, which is literally about bridging clinical, biomedical medicine, biomedical science with anthropology, history, sociology, and the bigger aspects of society. And what's happened to that specialty in the Swedish medical curricula? Well, it's been removed because it's not been seen as interesting or relevant enough. And we are now facing. I work with the Swedish Association for Social Medicine and Public Health, and so does Sahar. We know that we have 50 specialists in this. Out of 40,000 medical doctors, we have 50 specialists in social medicine, half of which are 65 years or older. And we have 4 residents in training. So even in a context where there is a possibility and there is literally this bridge exists and it's not being used. So on the previous discussion that Sybil and Sahar also commented on around whether it's useful to define global health. One thing that I find from my day-to-day work, which is in foreign affairs, for the Swedish Ministry of Foreign Affairs, so we have, I'm the only physician working in the ministry, and we have someone who is a nurse also, but then everyone else is a lawyer or a public policy specialist or statsvetenskap and so on. And the challenge there is that sometimes if you overemphasize the health sort of aspects of things, you sort of become the health person, and you're put in a box, and then there is the sort of environment people and the climate people and the global security people. So clearly, also from the experience working within government, it's difficult for us, even when we really try. And Sweden is one of the governments with a track record really of trying to bridge between disciplines and departments. Even there, it's very challenging to actually, in practice, achieve this, what they call multi-sectoral governance, actually getting people with different disciplines and different points of view together. Because again, to improve health, we need to improve climate and food systems and stuff like that. But it can be tricky to get the people who are experts in those particular areas to also understand health and vice versa. And we don't necessarily speak the same language and so on and so forth. So I think that also relates to Charlotte's question about, how to encourage inclusion. Part of that is about teaching the skill or the vocabulary of speaking with other disciplines almost. So I know some academic institutions in the context of SDGs and the Sustainable Development Goals are trying to do this, and actually literally, you have classes that are all about learning what do engineers do and what do urban planners do, and how do we interact with those people, so that you actually as a person get the skill both in understanding what others do and how to speak with them. And in clinical medicine, we have that too, where we try to teach nurses how to interact with medical doctors try how to interact with physiotherapists and so on. And that's been hugely successful and appreciated by everyone who studied. I think the next step then is to have similar interprofessional learning and teaching with disciplines far outside the medical field. You would have a week working with urban planners and engineers and economists to try to understand how to improve health on a larger scale, rather than simply how to interact with future nurses in a ward. Over.
Thank you. That's a very fascinating idea. Jesper, I see that you're raising your hand.
A very short comment. Hampus, I figured out how you can really make a contribution to tearing down the silos, and that is when you manage to make social medicine the first medical specialty which is not open only to doctors.
Mm.
That's a great idea. That's what they do in the UK. Yeah.
Oh, that's fascinating as well. So I see that time's running by so fast. I do want to move on a bit to the how, which I think we've already touched quite a lot upon. And since I think many of the members in our audience are medical students or students in other fields interested in global health, I want to ask, why should students or future healthcare workers engage in global health? And should they get involved at all? Are there any examples or times where it's not appropriate for them to engage in global health? Maybe Mahmoud, you could take a stab at this question.
Yeah, it's very interesting for me to answer this question, since I've been in both places. I've been someone from low middle income country as a doctor, and I've been abroad as a doctor, as an aid worker. I think it's very important for students to be engaged in everything, and one of those things is global health. And I think that we should expect from every person nowadays to have a basic knowledge of global health, just like we expect them to know basic knowledge of history and philosophy. So it's definitely something they should be trying to get engaged in. But it comes with a big, very important but, is that how they do it is very important. And since engaging in global health here usually entails traveling abroad, that's when it gets tricky. If you think that you want to work abroad in something related to global health, I would always say, think about your utility. What is your added value to the community you're going to volunteer or help? A couple of days ago, I was walking down in KI and I saw this poster on the board for med students to volunteer in India. And it had like a great picture of a kid, like a volunteer hugging an Indian kid with a stethoscope and everything. And I'm not here to judge, maybe it was a great idea, but I would ask whoever wanted to join or will join, is that, do you see your added value there? Like, if you go, what will change? And if you don't go, what will change? And this is the most important thing. If you don't go, will anything different happen? So always think about your utility. Always think about what you are going to offer to the community. What will they get out of it? And another thing that I've seen in my career is that some of the people come with "I know it all" attitude. I think those trips abroad is a very humbling and important experience to learn from others. The times I've been taught things from a community health worker about global health that I didn't know, by somebody who basically barely can read and write, just because they've been doing this for so long and they know the context and they know their country and they know what their priorities. So always keep an open mind and try and learn while you're out there. Thank you.
Thank you. Jesper?
Yes, you can say a lot about the house, and I probably have been guilty of some of the bad practices that were just mentioned. Being ignorant and young was one of them for sure. But I think many of the issues we talk about South and North, and we talk about structural racism and colonial practices, etc. Yes, but I think to me one of the main problems are global inequalities. It's that some countries are much poorer than some countries that are richer. And those inequalities are, to me, the root of the problem. And I think most people who want to get engaged in global health, they are sort of disturbed by those inequalities in the world. And of course, we should harness that good intention one way or the other, because most people in the world don't care at all about inequalities, or at least they don't think about it on a daily basis. So the few people who actually do, we need to cherish them and thank them for actually being so considerate. And then we, as you say, we need to show them how this could be done in the best possible way, perhaps. But definitely, of course, you should engage. You get more people to engage.
Thank you for adding that. To kind of follow up on what you both said, I think one thing that makes it difficult for students, perhaps, is that you aren't really an expert. So as you were saying, Mahmoud, it's hard to sometimes think, me as maybe a second-year medical student, perhaps I don't actually have a lot of utility in many global health settings. And so I think when thinking with a more critical perspective on global health, students may feel like actually there's no role for me in it. Do any of you have any advice to students that kind of feel like intimidated by global health and a more critical perspective of global health?
Actually, we wrote a pamphlet now 4 years ago on trying to give concrete advice to students in how to engage with global health. And I think to an extent rereading that and reflecting on some of these more critical aspects, there is scope to improve even what's in there in terms of that critical thinking, even though that was already very much on the agenda back then. And so we refer to some sort of ethical frameworks that exist for those who are interested in going abroad and so forth. And I think this is a challenging question, because many, even amongst those who are very critical to the idea of students or young professionals traveling abroad to learn about global health, many of us have had that experience as a sort of formative experience for ourselves, and that's been something that's inspired or taught us a lot. Maybe not the things that we thought we were going to learn. Maybe we learned that things are wrong, or we don't really have a place as as someone who can help out in a hospital, even though you don't have the qualifications and so on. Sometimes what you learn is, that's not my role, at least not yet, and that can inspire some people to then continue and excel as clinicians in their own hospitals or contexts, and maybe do clinical work abroad later on. The other aspect is, overall, it's a bit difficult to get into global health, for almost any way you do it, both because there are all these sort of ethical pitfalls, and it used to be way easier. If you read about like Hans Rosling and these people, they didn't really have to think about ethics. They just did things, and we should be happy that that's not the way things go anymore. But for a lot of people, when there's not a global health program or educational program available, it does take a lot of work to get into talking to colleagues and fellow sort of medical student friends like Lotta and your group within the medical association or other places. But it's possible. It does take a bit of extra work, but it can be done as long as you keep track of these things that Hans has also pointed out.
Can I add something? Do we have time?
Definitely. Yeah.
Okay, so I just wanted to comment on what Mahmoud and Jesper said, and I agree totally that I want to encourage everyone to work with global health because it's global concern, so of course we should. But I think what we've talked about is, well, first of all, it's good to have the right mindset and not to think I'm coming to save someone, or I'm going to teach these people how to do things, or I'm going to help someone. But really what Lily Allen said, that I quoted, that if you're coming here because your problem is my problem and my problem is your problem, then I think with the right mindset you can get quite far. But then also what Mahmoud said, you really need to add something, because I've been in missions where either I'm a clinical doctor and then there are so many visits by foreigners who just want to come and see, and then you can't do your work because you have dying children in the ward, and then you have these tourists coming who are not adding anything, and they are just really irritating if I'm the only doctor and there are like 50 kids who are almost dying. I've been in situations where our cars have been used for foreign guests and donors, and then we cannot use the cars for transporting patients. So you really have to think, am I adding something by going here? And I think humanitarian organizations I started my career with MSF, and I can say in every mission I was the only doctor for a whole population. So I was like really in remote settings in the mountains of Kashmir, in Uganda, in Karamoja, and I had finished my degree, so I was a doctor. And sometimes I felt, oh my God, this is overwhelming. I'm not too good. I don't know this. I don't know that. But then I said to myself, well, I'm the only doctor here. So then I think then it's legitimate because you're actually adding something. So I think don't be intimidated, but think about, and then as we've said, there are so many different aspects of global health. It's not just clinical work, and are we supposed to call clinical work global health? But you really need to think when you go to the field, am I disturbing the work that is going on, or am I really adding something?
Thank you. That's a great point. Sybil, did you want to add anything?
Yeah, just very quickly. I know we're out of time. I think educational visits abroad at an undergraduate medical training level should only really happen under two conditions. One is that there are strict sort of ethical guidelines in place. There's a very strong principle of do no harm. We know that there is a lot of evidence that harm has been done and is being done and is not being questioned. So I think you should urge your institutions to do something about that if these trips are happening. And secondly, I also think these trips should not happen if there is no exchange. So if students from the Global South can't come to Sweden and visit Karolinska, there shouldn't be, these trips shouldn't happen. At least efforts should be put in place. I know there are so many limitations for this to happen, but that is what global health is. It isn't medical students from Sweden going to Africa or somewhere else to learn something. It is a two-way stream. And this is also the educational foundation that we should set. And lastly, global health experiences can be sought locally as well. I have been part of capstone programs in the UK where global local health programs were encouraged. Students were sent to migration and health centers, Médecins du Monde, and they've had phenomenal experiences. They learned so much about inequities in health. They were sort of motivated to work in global health in their setting and understand global health in their setting. So it's so much more than the tropical visit to Africa. We have to sort of move away from that very sort of colonial and backward notion of doing global health.
Thank you. That's a wonderful final comment. And just for our audience, if you're interested in what Sibyl just mentioned, Médecins du Monde is also active in Sweden. It's called the Läkaresällskapets. So that's something you could definitely look up if you're interested in working at the local level with these inequity issues. I think we could discuss this for hours. I think we're all very passionate about this, and I've learned so much. I hope that our audience has also gotten a few things to think about and can keep on discussing this at your institutions or with your friends. So I just want to say thank you to you all for being a part of this panel, and thank you to everybody who attended. Yes, thank you everybody.
Thank you too.
Thank you, Lotta. Great work, and the whole Global Health Week has been phenomenal. So, well done.
Thank you very much.
Thanks. Excellent. Very interesting discussion.
Thanks. Nice meeting you all, and thanks to
Yeah.
Bye, everybody.
Bye.
Bye-bye.